Thank you so much for being here, Steve. As the Chief Executive Officer of People USA, which is a peer-run mental health nonprofit that creates, provides, and promotes peer-driven crisis response and wellness services across New York State, but also across the country and internationally. Inspired and driven by his personal lived experience, Steve has spent over 2 decades innovating crisis response services and system-level improvements that raise the bar on customer service, person-centered communication, trauma-informed care, empathy, and positive expectations for people's recovery and wellness outcomes. There is an incredible list of firsts that you have guided the organization to do, but you're on camera and you're ready to go, and we're so excited to hear from you. So just thank you so much for being with us, and the floor is yours.
All right, well, thank you very much. It's very nice to be here, and nice to see everybody. Okay, so here we are. We're a People USA. We used to be called People Inc. We actually had a very close relationship with On Our Own in Maryland years ago when we first started. They helped to get us going here in New York. And so it's really nice to be here today. So next slide. So we are a peer-run organization. Our mission is to educate, support, and empower people and communities to understand, manage, and overcome mental health, addiction, and social determinant of health challenges. We took on a bold mission in this organization because those of us that work here, which are all of us with lived experience, feel the need for systemic change so that people are treated with compassion and care and better opportunities for better outcomes for themselves. So that's who we are a bit there. Next slide. We've started some unique peer models. The Respite House was really a first for us in New York. We started it 23 years ago, the first Respite, and I did it in partnership with Sherry Mead at the time. And then we just kind of redesigned it a little bit to meet our community's needs. And so this is basically the respite that you'll see and hear about across the country that people are now operating, which is really nice to see something like this grow and be embraced by so many people. They have been studied, and you'll see some of the information in some of the research that you'll see. And also across Europe, they are also being studied now too, and expanding in Europe as we speak. So it's nice. Like I said, it's really nice to see something embraced and utilized and showing how it makes a difference in people's lives. So let's get into it. Next slide. Let's see. Okay, where would you rather go if you were in crisis? This is a hallway of a hospital, of course, where a lot of people, including myself, have been boarded in rooms, or not rooms, hallways like this during a mental health crisis, or would you rather go to the next slide? These are two of our houses' living rooms that are respite houses. And when I try to explain the respite house, I try to explain it as a bed and breakfast filled with compassion, love, empathy, and understanding. And that's, this is a much nicer environment, I think, to be in, especially if you're experiencing some emotional distress and trying to, get to a level of calm where you can think more clearly about yourself and about your crises and about your life. Next slide. This is another living room in another house that we have. We operate right now 4 houses, 4 respite houses in New York. But you can see I have, the professional music instruments are there. One of our other respites has a whole band room, an art room, things that help people feel more human when they come to the house, so that they can feel more relaxed. They can also show us a bit of their skills. We have a lot of musicians, a lot of artists that come through the houses, and it's really wonderful to sometimes be there. And once in a while I would sit in and jam with them as well. I'm a drummer, so I did put drums in the houses and made sure that they were there. But we do have the guitars, the keyboards, and then the art equipment is all professional art equipment. It's not crayons. Although people, I'm sure, love, to do work with crayons, but I wanted to make sure that people were respected in terms of their age and what they would like to work with or what mediums they would like to work with. So next slide. Okay, so the objectives of the respite is a little more detail of what we have created. It's really to prevent the avoidable psych ER visits and admissions. And I think Travis was talking about, when people often go to an emergency room, is that the best place for them to be? We did research 20 years ago and then again 10 years ago, and we looked at why people go to emergency rooms. And it's basically because they're open 24/7 is number one. Number two is they feel that that's the place they're going to get the support they need. But if you're like me and many others, you get to the emergency room, you're kind of marginalized, you might be locked into a separate area of the hospital, and within a couple hours you're so angry that you've forgotten about your crisis and you just want to get out of that emergency room. But in the research that we looked at, about 2/3 of the people that present in emergency rooms don't necessarily need that level of care, and it might even be more, but they really don't need to go to an emergency room. When I designed the respite, I wanted it to be a place where they were welcome, where they could talk about their crisis openly and honestly, even if it was suicidality or anything that was more serious for them. Just to know that they have someone that they can open up to and trust. And I'll talk about those how we get to that level of trust in a minute. We do help guests understand what happened. We want to understand what happened that caused their crisis if they know. We increase their awareness of skills and resources. All the staff in all of the houses and all of our services actually are highly trained and resourceful and know all of the different services in the community, are connected to those services so we can get people to appropriate services, whether they are traditional or non-traditional services, it doesn't matter. We educate folks through mutuality about ways to improve mental health and overall wellness so that they have can live a whole life, and examining the relationship between overall wellness and the guest's current situation. Next slide. We connect folks to services, as I said. We ensure that everyone feels comfortable, and they will be asked whenever they come to the house, are you comfortable here? Is there anything else we can do to make it more comfortable for you? And we just want to make sure that, I want to get beyond trauma-informed environment discussion to say that it's just a trauma practice that we do. It's a very trauma-informed practice that we serve people and ensure that we're looking at all aspects of every guest that comes to our houses are addressed. And that's very important. I think when people feel that they are important, and they are important when they come to our houses, they start to feel differently about themselves. And so that's what we promote a lot of, is helping people feel self-determined and important and safe. We want to prevent avoidable future hospitalizations, and we're 95% successful when we look back 2 years on former guests, whether they've gone back to a hospital emergency room or not, and they primarily do not. They come back to the houses, which is great, but they don't have to go into that level of crisis and go into an inpatient setting, which we like that. And it does break the cycle of going from home to crisis to hospital. And that's when I was in the hospital, this is what I was thinking about, of how do you break that cycle? How do you help people not have to go into those environments that can be very traumatic when you're in a psychiatric unit? Next slide. So why do they come? This is what they come in for. They're having acute psychiatric symptoms, as the traditional world calls it. Suicide, they're thinking of, adverse life patterns, trauma, addiction, chemical dependency, chronic health issues, strained relationships, social isolation, poverty, and economic stress. If you think about it, these are most of the things that people go to emergency rooms for. And it's nice to know that they have a choice. They don't have to do that. They can get a different and most times better level of care when they come to our houses to get the services. Next slide. So there are core characteristics that makes the house work. They are short term. You can stay 5 to 7 days. You can stay 1 day if you want. It's really up to you as a guest. And they are home-like. Like I say, they're like a bed and breakfast. We're constantly renovating and fixing up the residents as well to make them look even better. They're 100% operated by peers. There's no clinical components to it. And we have never really needed it. So it's been extremely successful in being 100% peer run. Highly trained, skilled staff. I can't tell you how much training we do. We've created our own training because we have helped open about 40 others in the country and in Europe. So we had to put a training manual together. And as we did that, we were very careful of how we did that and what the skill set was that we were looking for in the staff we hire, and the training they would need to rise up to that skill set and, become well established and secured and confident staff. The Rose houses are open immediately and accessible 24/7, 365 days a year. And the service is 100% voluntary. When you go into a place that you choose, rather than being forced into a place, you're probably going to get more out of it. You're going to feel more empowered. And that's the whole philosophy behind it. Guests can stay up to the 7 nights. They can come and go for appointments, jobs, other essential needs. Next slide. And this is why it works, that we figured out. There really were 4 pillars that we discovered that helped this all to work for us. And, number 1 was engagement. It's how you're engaged and how you're welcomed into the house. And we, in the very beginning, scripted that so that people felt, comfortable coming into a place they'd never experienced before. Welcome to the Rose House. We are so glad you're here. Let us tell you who we are and what we're about. So the staff will start this little education process while having discussion with the guest in figuring out why they're there and what it is they're going to need. We don't rush to do paperwork. We tell people, if you don't want to do any documents right now, we can do them later. We're going to explain what every document is, why we're doing it, why it's important. So there's a lot of transparency in the house, but the engagement is so key. And I often talk about, when you've gone to clinics or other programs, partial hospitalizations, that engagement is usually a Medicaid window or an insurance window where you have to kind of flop your card down and give them some information. It's not always the nicest waiting rooms and things like that. So to really start with the engagement being a nice place to walk into, engaging and welcoming and friendly, makes a big difference. Then there's the environment. What kind of environment are we offering people? And everyone should deserve just a very safe and comfortable environment to come into. So that's what we did. We, like you saw the pictures of the houses and the living rooms, bedrooms are the same too. They're all just very comfortable and engaging and nice to be, invited into. The mutuality is the lived experience. We are peer run. We're 100% peer run. And when you can share with somebody your story or your experience, it makes such a difference. And some of this I learned when I was actually, after my recovery, I started working in a hospital emergency room. And I treated people the way I thought they should be treated, not the way they were treated. And I would steal food in the best parts of the hospital for them. I would make sure that they're comfortable. I would make sure that they know what was going on. And that's where I learned about this mutuality, because I started to open up and share my own lived experience with people that were coming in. And immediately their heads would pick up and look at me, and you'd get all different kinds of comments. But there was comfort in that, and comfort in knowing that as difficult as their crisis was, they weren't alone. And that was so important for people to understand, that they're never alone when they're in our services. And then there's the ultimate philosophy of recovery itself. Do we believe it? Do we believe in it? Do we live it? And our philosophy is, yes, we do all of those things. My staff are just absolutely wonderful, where they have embraced recovery Because what'll happen is when you open a respite, the first thing that the traditionals will say is, well, what if somebody comes in and hurts themselves or tries to kill themselves or tries to hurt others or becomes violent? And you're getting all these negative questions that come in and the what ifs. And my what ifs were always, what if somebody comes in and just loves the greeting that they get and loves the environment and loves the support that they're getting and gets more out of that to where they're willing to share more with us, because that's important. When people can share and feel free to talk as they want to talk and speak what they want to speak about, they start to heal. It just starts to work for them. When you validate that, so powerful. You know, we want to always validate people. So what we're doing with these houses is not just, and I'll talk little bit about that. I don't have a lot of time, but you're not just opening a house. You're opening the house to the community, and you're opening up a community to think differently. And that's the idea that I started with, was how do I get the community to embrace the house, but also how do I get the community to shift to a recovery focus of embracing recovery rather than fearing symptoms and fearing the persons that they're serving. And so the house offers a lot more than just a respite for the individual. Next slide. So the guest criteria is pretty simple. You know, we say living with significant mental health or co-occurring issues. We don't really know, and we don't really care. So we just, you know, we had to do that to get it approved through the state to get a house open. This was back, you know, 22 years ago. But they wanted some kind of criteria. It says, okay, somebody lives with, you know, whatever. If you're experiencing a crisis, it's your crisis. And if you want to come to the house, then you come to the house. And if it's a mutuality of understanding of why you're there, you're coming in. Now, medically stable is important because we have had people come in that are dealing with untreated diabetes or untreated heart conditions or things that are not, you know, that are out of our scope of service, but we don't kick them out of the house. We bring them to the hospital if we have to, or the doctor, or whatever medical treatment they may need, but then they come back to the house. The resident has to be of a designated service area, which meant they had to be from a certain county if it was funded through that county. Well, I can tell you, we've had people from all over the country and different parts of the world have come to our houses. We've never kicked them out, but you know, again, we had put certain things in because we had to, you know, follow rules of the counties and the communities that we serve. They do have to be 18 years and older. We are starting to work on opening a youth house as well, but that's in the near future. Care for oneself and one's personal needs, highest level of care offered. Persons need education in independent living skills, and sometimes people they don't know how to cook. So of course my staff are going to cook with them and start to teach them some of those skills. We help them to maintain the beauty of the house. They can help with, you know, doing laundry or cleaning, you know, the rooms up or something like that. We want the guests to really own the house as well, so that they're not just thinking about their symptoms and their crisis, but they're also thinking about how they can help to make the environment better for everybody. Understanding, you know, in signing necessary documents. I mean, we do have to have some documentation that shows the efficacy and the efficiency of the house. So we do ask for that. Living in permanent housing was what I originally started with, because I really wanted to focus on people that were experiencing the crisis, not so much from homelessness or not having a place to go to, but just having that crisis that, you know, many of us have had when we've had stable housing. However, over the years, working with my staff, because I'm not the one, I don't want to just make all the rules up for this. I asked them, what do we think about bringing homeless folks in? Because we're going to have to let them go back out to homelessness. And so that's a very transparent, open discussion we have with every guest, because we do get folks that are homeless into it. And my staff have a hard time wrapping around, you know, letting someone go back to it. But if people are willing, that's their empowerment, their self-determination to make that decision for themselves. But then they get to also work with our other services, which are housing services. And so we've actually grown in that area as well, as providing housing for many people. Willing to adhere to a guest agreement. I didn't want to call them rules. I wanted to have an agreement where we agree as the house operator and you agree as the guest to respect the house, respect each other. And that's really what it comes down to. So we don't have a list of rules. It's more of agreeing how we want to treat one another while they're there. It is 100% voluntary and self-referral. So that means if an officer comes across someone that's in the community that's in need of some crisis care, the officer will take the phone and hand it to the guest or potential guest and have them call us. And within an hour or less, they can be in the house. And it's not just, I just gave police as an example, but anybody that calls us and says, I'm trying to get somebody into your house, the first thing my staff will say is, can you hand the phone to the potential guest? Because it's their decision, not yours. Capable of self-preservation, of course, and then sex offenders is a challenge because we are in neighborhoods. We can't always serve, everyone that comes through, but we do have mobile services that we would provide if people are on sex offender registries. Next slide. So here's some demonstration of cost savings. Some average annual costs of operating. This is just one of our smaller houses that operates at $1,065,000. It has been a cost avoidance of psych hospital usage, pretty dramatically. 7.2 mil compared to 1.65, serving, the number of guests that we serve, I think is a huge cost savings. And that's now being recognized by state governments and federal government, where it is being licensed and put under a Medicaid option, which is not my favorite thing in the world, but it is going to allow for more folks to be served as long as the philosophy and the fidelity of the model stay true to what we've created. Next slide. I do want to mention that, yes, they are co-ed. I just saw that question pop up. Yeah, they are co-ed because, we're serving adults. We want people to respect one another. We do have safety, in place for that. We've never had any major issues with it. So, and our houses, as we're expanding our houses, we're making them a little bigger, a little bit more separation for people. So it's working out. I mean, there are really no issues that we're having. So that's the basic premise of the house. There's so much more I can share, especially experientially of what we've learned. But I think it gives you a little bit of an idea of what we do and how they're run. So thank you.
Oh my gosh, Steve, that was such a window into the world of peer respite in so many ways. And I see questions coming up through the chat. And we have some time we can do some questions now, and then after also we hear from Vesper about Kiva centers, kind of both of you together if you're willing. But since you mentioned it, can I ask, what do you wish people asked you about peer respite that speaks to some of those lessons learned along the way?
It would really be about how does it work? What works? What makes it work, and what happens to the people after they leave? Because one of the things that's important to me is the follow-up. How are you doing? So we check in with all of our guests as they allow us. We ask them for permission, but as they allow us, we have found through the 8 dimensions of wellness that their quality of life has improved from not only the visit at the house, but also we follow up with our other services as well. And they've stayed connected to us. Many of us stayed connected to us. But I just want people to know how well it works. And that's what's important to me.
Amazing. I know there's definitely questions coming through the chat about some kind of specifics. But would you also speak broadly to that question of, in our world, sometimes data and documentation are essential ingredients in getting this to really happen? Yeah. As well as those community neighborhood partnerships with kind of, literally where are you, but also how are you interfacing with maybe law enforcement or emergency rooms, places where folks go who maybe aren't aware of peer respite or have questions about it because of thinking of that documentation and data mindset. Do you have any
Yeah.
broad comments on that?
I do. It takes a lot of work, a lot of engagement with community providers, with police departments. We actually do all of the crisis intervention team training in several counties here in New York. So we've trained a lot of officers on what we do. And we've also opened the first, and I don't know if it's the only, but Peer run Crisis Stabilization Center, which is a 24-hour facility that people can go for 23 hours, 59 minutes, and it's a wellness hub there, which feeds into our Rose houses. But it's really building community around the idea and the concept of what we do. It took me when I first opened, it really wasn't popular with hospitals and community providers until they actually started to see it work. So it took a good 2 years in my first house for it to take hold and people to trust it. That put us at the table, and not only are we now at the table, we're helping design the community services because of the work we've done, and it's we're at the head of the table, which is nice. Making those decisions with county governments and state governments on how they should operate their services and build integrated systems of care that work.